Hello and welcome back to the Stay Sure Wellbeing YouTube channel. I'm Dr Dawn Harper and today I'm going to be covering travelling during the pandemic. We are of course at the moment in the UK locked down and many of you will not be planning to travel. But going forward, if you want to travel, there will be some extra precautions that you need to think about. So I'm going to kind of tackle this in three sections if you like, before you travel, whilst you're travelling and then when you come back. So before you travel, really important that you check your itinerary and you check the rules and regulations, any local lockdowns or quarantine rules in not only your destination but anywhere that you need to travel through. And you need to know local rules, as some countries have different rules in different parts of the country. It's also important that you complete any necessary paperwork. You may be required to fill in forms before you arrive in a country, and you may also be required to fill in documentation when you return, confirming where you've been. If you fail to complete that paperwork properly, you could be delayed entry, or even refused entry, so really important that you do that properly. I think it's also worth checking out how you're going to get about when you get to where you're going to go. Obviously, best if you can avoid public transport, but even if you're going to use it, you may find that services are restricted. There will be fewer buses and trains, for example, and so social distancing may be more tricky. So just think about that before you go. It's also really important that you double, triple check your insurance. You need to know that you will be looked after if you should become medically unwell whilst you're away. So have that dialogue with your insurance company, be honest with them about where you're going, and especially if you're going to a high risk area, really important that they know and that you know that you're covered. And I also actually think it's worthwhile knowing a little bit about the medical facilities wherever you are going. So just have a little look online or ask your travel agent just to make sure that you know where the local medical services are, where the local chemist is, and possibly even learn a little bit of medical language, basic medical language, things like hospital and doctor, so that you can actually ask locals if they don't speak English where you need to go if you're not sure. Now, whilst you're travelling, it's going to take longer to travel. We've already seen it takes longer to get through airports than in perhaps, say, a decade ago. But courtesy of the pandemic, you are going to need to allow more time. And I think for a number of reasons. First of all, the temperature checks and so on that are going to be in place in many airports will take extra time. So allow that time so that you're not stressed and ruining the break that you've just planned. But I would also advocate, if you can choose to walk from the car or the station that you're arriving at into the terminal rather than using those shuttle buses, then that would be a good thing to do. And of course that requires allowing extra time. Make sure that you take plenty of face masks and hand sanitizer so that you have enough to cover the planned time of your journey and extra delays. And it's also worth checking with the terminal, ferry terminal, airport, wherever it may be, what facilities are open. You may well find that many are now closed and you might choose to take your own food and drink to cover your journey whilst you're away. It's also worth thinking about checking in online so that you don't have to communicate or touch things so much, and also make sure that you have ways of paying contactlessly. But many places now don't want to take cash for obvious reasons, so make sure that you have that in place. And finally, when you return, just recently a friend of mine went to Portugal when Portugal was in relatively low risk and there didn't seem to be a problem, and whilst she was away, Portugal was added to the list of countries from which you needed to quarantine. So I think you need to be prepared. Things are changing very rapidly at the moment, so make sure that you know what the rules are when you leave. And if you are going to an area that requires quarantine, you do need to be able to quarantine when you come home. If things change, you need to know whether you can get home more quickly to avoid that quarantine, or if you do have to come back after the point of quarantine, that you are able to quarantine. And a little word, a plea, if you like, from me as a GP. It is thought that only around 20% of people take quarantine rules absolutely seriously and adhere to them. The other 80% bend and some flagrantly break them. So please, we are in really tricky times here in the UK. We are seeing cases rise. and again seeing some very frightening numbers of deaths. And really we all have to do our bit. So as irritating and as difficult as it may be, if you need to quarantine, then please adhere to those rules, and that really does mean staying indoors and not seeing other people. Whether you're travelling to, whether you're there or whether you're travelling back, please, wherever possible, it really does make a difference to maintain social distance. That 2-metre rule is really significant, and if you can stay 2 metres away from other people, your risks of contracting the virus are significantly reduced. And if you should inadvertently be shedding the virus, risks of transmitting it to others are significantly reduced. So regular hand washing and social distancing, wearing a face covering, and apart from that, have a great holiday.